Hi everyone, I'm Dr. Ken Rousslang, and I've gone through the most reputable medical journals to find the most up-to-date scientific evidence on how to get you into the best shape of your life. Thanks for checking out my video on knee pain. As a doctor, I see a lot of complaints of knee pain, so let's jump right into it. So what I'm going to do here is first explain the different types of knee pain. So if you can come here and look at my knee, I've drawn out the different anatomical portions of the knee. This black line here that's extending both ways is the joint line that's separating my tibia, which is the main weight-bearing bone in the leg, from my femur, the major weight-bearing bone in my thigh. People that have pain on the inside portion of their knee, I've labeled this OA, and that's for osteoarthritis. The most common cause of knee pain is osteoarthritis. This is the wear and tear arthritis that typically affects people, especially athletes, as they age. People with osteoarthritis often complain of pain that's deep within the inside of their knee joint, and it's something that gets worse with exercise. Down here, I have this blue strip over my patellar tendon, and this is where people that have patellar tendonitis complain of pain. This is often exacerbated by things like jumping, running downhill, or even heavy squats. Maybe you've seen Rafael Nadal or other professional athletes wear straps right below their kneecap. That's because they oftentimes have patellar tendonitis right over this area. RN is for runners, and this is where people feel runner's knee. They usually complain of a pain right behind their patellar bone. The patellar bone is what I've outlined here in this black circle, and then just behind that, usually in the front, but sometimes towards the middle of the knee, people complain of the runner's knee pain. It's also called jumper's knee because, again, a lot of people that jump or run regularly have pain in this area. And then lastly, on the outside of my leg, I have IT band syndrome. This is where the IT band connects to the knee joint and runs along the outside of the thigh. And people with pain on the outside of their knee oftentimes have iliotibial or IT band syndrome or IT band related pain. My workouts are going to go through one by one and show you the moves that are best to alleviate pain for all of these conditions. The first move for my knee workout routine is going to be the wall sit. So you right over here. And this is really, I think, the #1 move for preventing arthritis of the knee. And what I'm going to do is set up here, just like I'm sitting in a chair, feet shoulder width apart. I'm going to sit back. The idea is to create 90 degrees between the floor and my ankles, 90-degree bend at the knees, and a 90-degree bend at the waist, the abdomen as well. This move targets primarily quads, but also it targets the gluteus and the hamstrings as well. And what that's going to do is, as you build strength through this isometric hold, you're going to increase the muscle strength, the muscle density, and you're going to expand the joint space. You're going to increase space between the femur and the tibia in your lower leg. Notice I try to have my back flat against the wall here as I do this. I'm starting to sweat, guys. I don't know about you. Very good, everyone. Next move I'm gonna do are side hip raises, all right? So if you've ever had an ACL tear or a meniscus tear or structural damage to the knee, your physical therapist or doctor may have recommended these side leg raises. And these are great, and if these are what you're comfortable with, I want you to stick to it. But in order to engage the whole core and get that six-pack that you're looking for, I'm gonna kick up the intensity a notch. I'm going to do side hip raises, so watch me everyone. I'm going to do 25 reps per side. 5, 4, 3, 2. Be sure to keep the core engaged. See, this is also working the hip abductors here, but at the same time, as a bonus, hitting my obliques really hard right now. This is a tough move. especially if you're trying to get 25 reps. That's not easy. So if you're in here doing this at home, you're doing a great thing for yourself. And that's it. Good job, everyone. Okay, same thing other side. Rotate around my mat this way. Give me a break at the pause button. I'm going straight in. 5, 4, 3, 2. You'll notice that this incorporates the same movement as a side plank, which is also a great move. But when we add a concentric contraction to it, it can really stimulate muscle growth. And that's going to make your abs look more ripped. As always, squeeze the belly button into the spine. Squeeze those abs through this movement. Good job, everyone. Hang in there. Last couple. Last one. Good job. Good job, everyone. Now we're going to give our obliques and our hip abductors and lateral leg a break. I'm going to go to something called crunchy frogs. It's a lot like an in and out, which is great. Now I'm going to add the arms. I get a full body workout. Are you ready? 5, 4, 3, 2, 1. Do 25 reps. Great. Sit down in a chair all day. Have tight hip flexors. Good job, everyone. So the next move in this knee workout routine is the single leg squat. Now, this is an advanced move, so if you can't do a single leg squat, I want you to modify it and do a double leg squat. And that's pretty simple. You just sit back in the chair, keep your knees over your toes, keep your chest up, and do a squat with both legs. But if you're in good shape and you really want to help protect those knees, then we're going to do the single leg squat now. We're going to do 10 per side. Ready? Okay. Starting with the left leg. 5, 4, 3, 2, 1. Really good at working those small stabilizing muscles of the knee, muscles you may not have ever even heard of, like popliteus and anterior tibialis, but nonetheless these are very important muscles for developing knee strength and preventing knee injury. If your foot touches the ground, guys. Nobody's perfect. One more. That was tough. All right. One side down, one more to go. All right, everyone? If you need a break, hit the pause button. If not, we're gonna start right away. 5, 4, 3, 2, right leg now. If you can, you wanna keep that opposite leg, my left leg right now, as straight as you can off the ground. That's really difficult. job, everyone. The next move for my knee workout routine to prevent arthritis is going to be geared towards preventing pain in the iliotibial band area, or the outside of the leg. And this move is going to be oblique crunches. I'll set up like this on my side. Again, a lot of people recommend this move if you've ever had an ACL tear or a structural damage to the knee, because it's going to strengthen the outside of the leg and it is going to add stability. But because I want you to get in shape as well as rehab and prevent knee injury, I'm going to take it up a notch and we're going to do oblique crunches like this. And I'm going to put my hand back here. I'm going to touch my elbow to my knee every time. I'm going to do 25 each side. Ready? 5, 4, 3, 2. You can definitely feel my core, my obliques engaged, as well as my hip abductors. We're going to strengthen my IT band. Get up, guys. I know it burns. Hang in there. Good job, everyone. Same thing, other side now. 25 again. Ready? 5, 4, 3, 2. Trying to make contact each time. Very good. Good job, everyone. We're going to go ahead and now work on the back of our legs a little bit. The first moves work primarily quads and the anterior aspects of the legs. And now we want to work the hamstrings and glutes. That way we prevent an imbalance of strength across the knee joint. All right, so my next move is going to be a 1-minute bridge hold. Start like this. Pull my butt up off the ground. I'm going to hold this for 90 seconds. So this move is really good at activating the largest muscle in the human body. You guys know what that is? That's right, the gluteus maximus right here. It's important not to neglect that. Even though we're talking about knee health, this is an important muscle in stabilizing the knee joint. Okay? And for the last 40 seconds, I'm going to increase the intensity a little bit. I'm going to go one-legged for 20 seconds each, all right? So keeping your feet together. Start with my right leg, 20 seconds. Feel the burn, guys. Keep it up, you're doing great. Whether you're an athlete or not, you are protecting your knee by doing this workout. I want to see you in crutches or in a wheelchair when you're older in the hospital. First thing I'm going to tell you to do is do my workout. Back down slowly. That last move really worked the back of the legs. Now we're going to go back to working the front of the legs, the quadriceps. And to do that, I'm going to do a yoga pose. So follow me. I'm going to reach up, stretch your high, come down, do a little hamstring stretch, and sit down in my chair. I'm gonna hold this for 60 seconds, everyone. Notice my feet and my knees are together. My knees are not extending forward past my toes. I'm just trying to sit back just like I'm in a chair. So while one-legged squats are a good concentric exercise, which means the muscles are shortening as they're contracting, this is an excellent isometric exercise. So my muscles aren't moving anywhere. There's a whole lot of tension. They're working real hard right now, I can promise you that. Oh, the sweat getting in my eyes. It's all right. I love it. Good job, everyone. Come up nice and slow. Very good. Now we're going to give the front of the legs a break again. Go back to the back of the legs. And this move is called marching plank. So I'm going to sit up in a plank. I'm going to do this for 60 seconds. And I'm just going to lift my leg off the ground one at a time. All right. 5, 4, 3, 2, 1. Really squeeze the glute. Extend those legs, keep them straight. If you've hung in the workout this far, I just want to say thank you for hanging in there so long. You are really doing yourself a great favor. I became a doctor because I love helping people. And if this helps even one person get in shape and help protect their knees, then I'm also grateful. Squeeze those glutes. Bring the belly button into the spine. Engage the core at all times. This is not easy. Okay, a couple more seconds. 3, 2, 1. Good job, everyone. Okay, everyone. Now that we've hit the back of the legs again, we're gonna go back to the front of the legs. I know, right? It's just back and forth torture. We're almost done. Hang in there. So my next move is gonna be a squat run. I'm gonna just get into a squat like this. I'm just gonna start running, okay? For 30 seconds each leg, 60 seconds total. 5, 4, 3, 2, go. Notice the angle changes a little bit with my front and back leg, so it's good. Probably have 60% of the weight on my front leg, 40% on the back leg, and I'm moving, so I really work those small stabilizing muscles too. Okay, 3, 2, and switch. So keep running, don't stop. Now my right leg has the majority of the weight. Working the obliques and the core too. Everything from my hip flexors to my hamstrings, my quads, and my ankle joint. Being stabilized right now. Hang in there, everyone. Almost done. Keep it up, come on. It's just like a race. 3, 2, 1, and bring it down. Good job, everyone. Okay, so now that we're done with the hard and furious part of my workout, it's important to cool down. So what I usually like to do are some really basic hamstring stretches, just like this. Drop the head, make sure to drop your head. Okay. I also like to do quadricep stretches. We really hit the front and the back of the legs today. So I'd hold it just like this, posture upright, and hold it with 2 legs. Sorry, hold it with 2 hands, or with 1 hand. Keep up straight. But I don't want to make this video an hour long, so I'm not going to hold these stretches with you guys. But at home, it's really important to make sure we stretch, cool down properly. It's going to help make our muscles more flexible, more durable, stronger, and more resistant to injury in the real world. Okay, everyone? Good job. Thanks for watching. If you enjoyed the video, please click like and subscribe. See you guys next time.